Hello, good afternoon, everyone. Wishing all of you a happy Lunar New Year first. This is our first English Health Talk since the Chinese New Year. So wishing all of you a happy Lunar New Year. So previously for the Community for Prevention Health Talk, we talked about home safety and also about food that is high in calcium. So for today will be our third series of the Community for Prevention. And we invited staff nurse Michelle and staff nurse Vincent, who will be sharing you more about today's health topic. So passing over to you, Michelle and Vincent.
Hello, good afternoon, everybody. Everybody can hear me? Give me a thumbs up. Okay, yeah. Okay, I will start to share my screen. Okay. So today, our health talk is on this community for prevention series 3 lah, huh? So today, Vincent and me will be talking about the proper footwear and vision care for elderly in the community lah. Okay. Then Felicia already wish you happy new year already lah. Today is also Valentine's Day lah, so I also wish everybody happy Valentine's Day. Okay, so today content will be giving you some introduction about fall and what are some of the consequences after you have fall lah. Then so today our topic is about choosing proper footwear. So we'll give you some tips on what to wear when you're going out or even when you're at home. Then some of the common problems or eye problem that the elderly have, and the management of eye care, and some tips the take-home message for you. Okay, so what is a fall? So it's a unexpected event in which the participants, which is anybody not only elderly children, even myself, I can fall down So in which the participant come to rest on the ground, floor, or the lower level So it means that you must be landed on the floor, or you from second story you roll down from the stairs from one level to the lower level Okay. Okay. So next, okay, in Singapore, right? Age above 65 to 70, right? Okay, out of this age, right? Out of 3 people, right? One person will fall down. We never say elderly, one people will fall down every year. Okay, out of 3 people. So when you are aged 72 to 80 years old, tendency of you falling will be 2 times one time every 2 years lah. Then if you age above 80, right, tendency for you to fall will be actually every year lah. Okay, so many elderlies are actually silent fallers and they don't report their falls. People say, accidentally bo siu sim they don't consider themselves Okay, then they don't seek for any medical assistance unless they are injured, like get cuts get bruises Okay, then fall actually can be very serious and it will lower down your quality of life, which I will further explain later. So in Singapore, actually, the statistics says fall actually cause death up to 40% So there's elderly or people that actually die after they fall. Okay. Okay, so what are the consequences when you have a fall? Okay, so fall can actually result in different complications from fracture yourself to long-term hospitalizations Okay, so let me go through one by one Okay, so just now I did say fall usually can cause you to have some fracture. Okay, so some of the common area that cause you to have fracture will be your hip, because you land on the floor. So your hip, your buttock okay, will tend to hold your weight. So tendency for you to have fracture is over that area. And also your forearm, because you use your hand to hold on a table, on a chair, on a wall, anything. So it's also one of the risks that one of the body part that will have fractured when you have fall. Okay, then definitely when you fall, then you will have pain lah. Okay, then you have some discomfort. Okay, yeah. Then if the pain is intolerable, then you will get your attention to go and see a doctor. Then some people like may have some chronic disease lah, health problem lah. Then you because you fall, right, then you may be afraid to walk all this. You won't want to walk. Then you will cause you to have this prolonged immobility lah. Means you have not been walking for a long time or for a short while. It actually have a great consequences on letting you to be working as per normal as your own norms are your baseline. Okay, then difficult to move around, like just now I said, like you share that because you don't move so much because you're afraid you fall, then you will lose your independence. You know, it depends on people. Okay, then your walking will be unsteady and your walking pattern will be different. You will slide to one side or you will move forward to one side because of the pain and the uncomfortable. So you tend to slant one side. So you will see elderly, they don't walk properly one. They will walk one side lah, or one of the leg will be keeping straight, the other leg will be on rest lah. So your posture will be different. Okay, then you will lose your independence. Okay, just now I share how you would ask people to depend on people. So there will be some routine change. Shower, you need somebody to come and help you. You need to wait for the home help service to come and shower you. You cannot shower yourself, or you wait for your family members to come and shower you. Need to rely on people to send you for transport to go and see a doctor. Okay, then it will cost some financial causes to, because you stay in the hospital so you will have some money incurred okay, then you will some psychological consequences will be like you have fear in falling again because you fall down, then you know the pain and stuff. Then you will feel frustrated because you cannot do whatever you want to do. Like last time, your family member will say, "Hey, don't go out, you stay at home because you fall easily." So everything will be restricted Everybody have experience staying in the hospital, right? Once you fall down or you are old the nurse don't let you come down, always stuck in the bed one. Cannot. Must press the bell, then you can come out from the bed okay. Then you will lose some you will lose your this social interaction with your friends because you are at home most of the time. And just now I did share the last one, the very serious one, is that it will cause you to death okay, like 40% in Singapore, the statistics say people fall and die after they have fall okay. So these are the 5 tips to prevent fall. But today we will be focusing on this proper footwear and regular eye check So Vincent will be sharing with you about eye check, while I will be talking about the wearing of well-fitted and non-slip shoes okay. So, okay, why do we need to choose proper footwear? Why is it so important that we need to have a discussion today Because if you wear a proper shoe, right, you will align your feet as shown in the picture, your ankle and your knee and your hip, so that they can correct your gait and posture when you walk Okay. Then so a good shoe with proper sole then you prevent you from falling down some elderly, the shoe is very slippery, really lost the grip, so it's very dangerous if they walk on the road at the lift there or even at home okay. So the grip is actually very important. Then it also aid in support and stabilize your foot so if you wear a proper shoe, then it will actually give a good grip to your leg which I will further explain later how to choose your shoe excuse me. Okay, so what make proper footwear okay. So is so all the red color one is important okay. Why is very important for us to wear a good shoe So okay, first we go for the bottom okay. So you have to have a good firm heels okay, a big broad heels and firm. So it helps with stability. Then after that, when it's low, right, not tall, like heels like that, not platform, not thick one, those like, very, very thin. Okay, so it will have maximum contact with the ground. Also, you feel more steady when you're walking and you feel more secured. Okay, important thing is feel secure when you walk. Or if you feel the shoe don't wrap your leg properly, right, you don't feel secure and you don't walk properly. Okay, then the sole, just now I said, must be slip resistance, means able to give you a good grip, okay, when to prevent you from the fall, because if it's very steady on the floor, then the risk of falling, slipping off is lower. Okay, so this fastening mechanism, the Velcro, the shoelace, whatever, okay, this thing is also important because it ankles your foot, okay, firmly to the shoe. So it's like tight on, okay, give you more secure. So when you move, right, the shoe move together with you. So it will not prevent you from tripping on a stone tripping on anything that can, like some obstacles that you will see when you're walking okay. Then okay, the front shoe this one the toe here cannot be very tight, must be also like broad, okay, must be comfortable for your 5 toes okay, 5 little toes to be inside and feel comfortable okay. Then not too loose also, because they are supposed to hold on to your toe and walk, okay. Like I said, you have to your foot and your shoe must be as a whole so when you move, your shoe also follow you, okay. Okay, so these are some of the example not good one okay, not so advisable. I cannot say not good. Some shoes are good, but just not so encouraging for elderly. Okay, so you see the cross one, the slipper, whereby you used to need to grip with your 2 toes. Then when you walk, right, the back part is not holding your foot together so it's actually very dangerous to trip Okay, so you see that this grip for this shoe is very good. Okay, a lot of very, very obvious grip and deep deep grip that is underneath the shoe sole. Okay, then you see with this Velcro across it to support your leg Okay, then okay, the shoe that you should avoid like I said, pointed. Okay, you should have the round one sorry. You should have the rounded one, so it's comfortable for your 5 toes to be fit into the shoe. Okay, so this one is like poor fitting shoes Then you see the sole is already wearing off already. Cannot see the grip already dangerous So these are those slippery part that can cause you to fall down. Okay, these are very good this shoe, but why we avoid? Because don't have any thing to hold on to the shoe. So you still like, actually it's like another kind of slipper because it's slip in there's no Velcro, no stripes over to protect your leg. Then move them as a whole then you see these long heels minimal contact with the ground so it's also not very encouraging to wear high heels when you are age above 65 Best to wear sport shoes with this what is it called shoelace or Velcro, and we have a good grip here Okay, so moving on, we will talk about the eye care. Okay, going for this regular eye checkup. So now I'll pass on to Vincent that he will carry on from my presentation. Vincent, please.
Thanks, Michelle. So you know that actually in Singapore, there has been a prevalence rate of 27.9% of elderly aged 65 and above had falls due to poor vision. So actually, as age increase, there is also a higher risk of developing eye issues, and this can relate to fall. So I'm now going to share with everyone with regards to how we can make sure that we can prevent falls through eye screening, regular eye screening, and how to take care of our eyes. So as we reach our 60s, you may notice that actually when we are reading newspaper, we are browsing through the internet, we will see that, how come we need to focus harder? We need more light to see. So because of this, then we have difficulty in differentiating between some colors. Sometimes the color maybe look a bit orange, maybe not so vibrant colors. And in particular, some shades of blue and green may be a little bit different. So besides having problem focusing on the things of colors as well, and also things like focusing on near objects and far objects will be a little bit difficult. And because of such risks involved, sometimes our perception of depth will be affected, and this can give rise to risk of fall. And besides that, sometimes when you head out, like in a bright sunny day like today, when we head out and walk, sometimes the sunlight, when there is reflection on the ground, you will see a lot of glare. And this glare can be not perceived as by our eyes that is something that obstructs our vision and disrupts our vision. And this can also result in fall because we did not see the danger that is ahead of us. Next. Yeah. So these are some of the common eye issues that elderly face in Singapore. So the four common eye problems are namely cataract issues, glaucoma, diabetic retinopathy, and age-related macular degeneration. So I'll just go through a little bit more with regards to each of the condition. So if regards to cataract, so cataract is actually there's a blurring, there's a cloudiness within the cornea, within the lens of the eye itself. So because of aging, because of exposure to UV, as well as sun rays, and over time, this can actually result in a layer of protein which is formed on the layer of the lens itself. So occasionally, some of the signs and symptoms are cloudiness. Sometimes when we see certain things, there might be white patches. Then we cannot even see very well because like there is like a blurring of like a frosted screen in a way. Yes, so that is a classical sign of cataract. Well, for glaucoma is also one of the common eye problems in elderly. So what causes glaucoma is because there's an increase in intraocular pressure. So this increase in pressure within the eye itself, it can result in pressing onto the optic nerves, which there's a nerve that actually transmit the signals to the brain for the image. So because of the high pressure within the eye itself, it can cause the image to be patchy and you can see dark spots. So these are classic signs, like you see dark spots, dark patches. These are signs of glaucoma. Okay, the other form of eye problem will be diabetic retinopathy. So as you can derive from the word diabetic, so it's actually derived because of the complications arising from diabetes. So what does diabetes do to a normal person? Prolonged exposure to high levels of sugar in the blood itself can damage the blood vessels within the eye. So if there's an interruption of blood flow in the eye, within the eye itself, and there's some damage to the vessels itself, this can result in loss of vision as well as you can see patches, like dark patches, something akin to glaucoma. And last but not least, which is age-related macular degeneration. So as the name per se is age-related. So as we age, right, there will be a tendency, there might be a higher risk of developing macular degeneration. And this degeneration is somehow, it can be caused by chronic disease, like chronic exposure to, like for example, we may have diabetes. And because of this, the retina itself, which is part of the macula, which is part of the retina itself, gets affected, and thus the vision gets distorted. And these are some of the eye problems in elderly. Next slide, please. Yeah. So right now I will share a little bit regarding eye care with everyone. I'm sure everyone does know how to take care of their eyes. So I'll share a little bit of tips with everyone. Okay. So first and foremost, it's very important that we practice good personal hygiene. So whenever we wash our face and we want to dry our face, we must always remember to use a clean towel and to wipe the eyelids. And sometimes we may be sharing towels, which may not be a good practice, because sometimes the bacteria that is lodged on the towel that may be from others gets into the eye, and this is where eye infection can occur. So remember to use individual towels for everyone. So do not share towels, and remember to clean your eyelids well after you wash your face. Like sometimes you can see a little bit of yellow discharges, and just observe. You can clean it off using just using a clean towel. You can just clean it off. Yeah. So remember, do not share towels, and do not use your hands to rub your eyes. So the key thing is, because our hands, sometimes when we touch other objects, our hands harbor bacteria or probably viruses around. And when we touch our eyes, we inevitably also creates the opportunities for bacteria to enter our eyes, and this can cause eye infection, which can disrupt our vision as well. Next slide, please. So besides this, the emphasis on healthy lifestyle is important, which I mentioned just now earlier on with everyone, for the different different types of eye issues, eye disorder. So one of the main important thing is to maintain a healthy lifestyle. So how are we going to do it? So first and foremost, it's very important to check the blood pressure and keep the cholesterol level at an appropriate level. So how to do this is to, you can, if you have a blood pressure machine at home, you can check it. If you have community nurses around you, then you can probably schedule a visit with the community nurses, and we can also check out on your blood pressure and ensure that everything is in fine shape and everything is okay. And when you go for your checkup, you can check the cholesterol level, make sure everything is within normal range, because all this can precipitate risk for developing eye conditions. So for people who smoke, we will advise against smoking, as smoking can lead to many other forms of disease as well. Besides this, we will encourage everyone to adopt a healthy lifestyle. Yeah, right. Health Promotion Board have actually mentioned about having at least an adequate 150 minutes worth of moderate intensity exercise, right? That can be brisk walking, can be just, gardening, all sorts of activities that, can keep us moving, keep us active, which is very important. So besides this, having a balanced diet is important, which I'll share with you all later on some of the different types of food that we can eat. And most importantly, to have regular eye checkup, which is every yearly when you go to the polyclinic or you go to the eye center for your regular check, is very important, because this will determine how is the health of your eyes, as well as to detect for any anomalies that can be treated early. Yeah. Next slide, please. So some other ways that we can help to make some changes to help us see better and preserve our vision is to have adequate lightings when watching the TV or reading. So like, for example, you could have an adequate distance, meaning to say that you have enough distance between your eyes and the TV, like the sofa set with the TV should be about 2 meters away. Yeah. And also at the same time, to give yourself time after maybe sometimes we like to watch drama, catch long drama, then we watch already, then sometimes we want to continue watching. Yeah. So remember to give our eyes a break, right? Look something far away, especially maybe something that is green in color, that is good for the eyes. It actually helps to relax the eyes. Yeah, and another thing that we like to share with everyone is smartphones, smart devices. I guess everyone is over here is very tech savvy in terms of using mobile devices to view our favorite dramas on YouTube or Netflix. Yeah, and sometimes we may have the habit of lying down and watching watching the, using the smart device and watch while being on the bed, lying down is quite comfortable. But however, because of the lack of lighting, as well as the close proximity, closeness between the smartphone and the eye itself, prolonged usage of prolonged usage can lead to issues such as short-sightedness, can also lead to issues at a later stage, which will result in the visual loss as well. Next slide, please. So I'd like to share with everyone on having a balanced diet. So what are some of the balanced diet we could propose to everyone? Is to have some antioxidant. So antioxidants is prevents oxidation, so it helps to keep the cells healthy as well as the tissues in the eye healthy as well. So what are some forms of good vitamins? They are from your group of vitamin A, vitamin C, and vitamin E. So these can be found in many natural occurring food sources. So we don't really have to say, oh, we need to take this vitamin, that vitamin, and all the things. The normal main bulk of vitamin that we consume every day should come from the natural food that we take daily, and not just based on supplements itself. Yeah, the best form of vitamins will be from food itself. So some of the sources of fruits will be the orangey color one. So like, for example, oranges, for example, your grapefruits, your apricots, tomatoes, all these have beta carotenes in them, which is good for eyesight and for skin as well. Yeah. So other than that, you can have a mix of nuts, seeds, dairy products like what Michelle has shared earlier on to build up on your calcium as well. Vitamin D, which is also important, have probably when you go out, head out for a morning walk, when you take in sunlight in the morning, is healthy sunlight with less UV. So it helps to synthesize calcium as well. Yeah, so these are some of the examples that you all can try, the diet you all can try. Next slide, please. Yep, so if there's any issues, like some of us, we may develop certain issues along the way. So how are we going to tackle all these issues, right? So these are some of the signs and symptoms that would render us to consult an eye care professional when needed. So for example, if let's say if you develop persistent eye pain, like suddenly there was a very, very sharp eye pain and there's a burning sensation, you see a bit of redness in the eye, which or probably some bleeding in the eye where you see yourself in the mirror, then probably this is some of the signs that you should actually consult the doctor. All right, when you see yourself on the mirror, if you notice any cloudiness in the transparent part of the eye, which I mentioned, the lens of the eye. So these are probably some certain, if it's obstructing the vision and is severely causing you discomfort, then it will be better to have an eye specialist to have a look at you, to go back to a polyclinic to have a doctor to see before a referral can be taken. Yeah. And besides that, like what you can see on the bottom left hand on the slide itself, you can see there's a encounter loss of vision. So this is called a tunnel vision. You see, it looks like a tunnel itself. So this tunnel vision is actually can be a form of glaucoma itself, because it's a severe form of if let's say if glaucoma is not yet treated, because there's no signs and symptoms of it, there's no pain, it's just so sudden because the pressure keeps increasing. So slowly there will be a loss of vision. So this one definitely need to go and see a doctor, yeah, and get it checked. And mention to everyone about the discharges that you can see in the slide also over here, like certain discharges. If you can see yellow discharges, if you see persistently you're tearing, you're having a lot of discharges, yellow, dried discharges, maybe it's time to also have the review by a doctor as well. And last but not least, if you see any floaters, so like for example, you can see on the bottom right hand corner of the slide itself, some floaters, and this can be macular degeneration, macular detachment. Sometimes you can see, like you close your eyes, you can see something floating on the eye. So it's better to get an eye check, and this should be a yearly process to actually find out the problem before the problems gets bigger. Okay, next slide, please. Okay, so right, if let's say you're already diagnosed with an eye problem, so what can you do? So we still can be independent in the community. We still can do our best by making some modifications to the things that we do. So for example, a safe home. So what constitutes to a safe home? So having adequate lighting is one of the important things, and removing clutters in the house, and that can prevent trip and fall. Sometimes because of the eye, the vision itself can also result us in the depth of perception is not very clear. So sometimes we may kick onto something and we trip and fall. So besides this, family members can also play a supportive role in helping the seniors in navigating, help in getting them the items. This will go a long way, definitely. So besides this, we also can modify a little, like magnifying glass. I believe in certain supermarkets in NTUC, yeah, there are some counters with the magnifying glass, which you can actually see what is the content of the food, yeah, in certain outlets. Yeah, so besides this, you have medication pill boxes as well. So why is medication pill boxes good? Is because you don't have to dispense the medication one by one. If let's say eyesight, there's some issues, then if you get your family members to pack your medications for you, then you will know, okay, I don't have to have the trouble of preparing what the medications, then you know that you're taking the medications correctly. So, but however, if you're taking medications on your own and there's no one there to help you, probably you can label the medication label into a bigger one. You can ask the pharmacist who is dispensing the medications to you to write in bigger letters for you. And this can actually go a long way in helping you differentiate the correct medications and not taking the wrong medications. So last but not least is to avoid weightlifting. So why is the weightlifting avoided? It's because after surgery, let's say if there's after cataract surgery, if let's say if you were to lift heavy things, it can result in the lens itself, the lens that is attached, being detached from it. And this can cause severe eye pain, which really requires medical attention urgently. Next slide, please. Yeah, so the main take-home message that we shared today, myself and Michelle shared today, is both poor vision actually can, and improper footwear can result in falls. So with these two, it's very important that we make sure we know what are some of the ways that we can reduce the risk. By reducing the risk of these two issues, we can actually result in reducing the outcome, which is falls. Next slide, please. So what has Michelle has earlier shared with you, the 5 points. Yeah. So first and foremost, slip resistant sole, very important. So must make sure that when you choose the shoe, it must be slip resistant. And don't get those one with the holes or that one already botak already lah. Those don't take lah. Okay. Then the one that you see the shoe down there with a low broad heel, low broad heel in a way because it's stable, right? Low broad heel. Then when you step on the ground, it's stable. It's not like something high and all the things which easier to trip. Then besides that, when you see the front of the shoe itself over here, the front of the shoe must be comfortable for you. Cannot be too loose, cannot be too tight. If it's too loose, then it defeats the purpose. If it's too tight, then it cramps up your leg, and it makes your leg very uncomfortable, and your balancing will be affected. Like what Michelle has earlier shared about the alignment of the legs is important, yeah, to prevent falls. And besides that, will be the secure fastening mechanism, yeah, the Velcro or shoelaces. Some people may like to use wear your sports shoe, yeah, or if let's say you're using the Velcro, make sure the Velcro is still intact, is still able to stick properly and not loose. Because if let's say you lift off your leg, then the shoe is very unstable. It also can result in falls as well. So last but not least is having a firm heel counter, yeah? Firm heel counter, make sure the heel itself is firm and it sits nicely on the ground itself. So these are some of the very important take-home messages that we would like to share with everyone. So the choice of footwear is very, very important. Yeah, next slide, please. So other than that, we would like to also, we have actually shared with everyone with regards to the common eye issues, the four different common eye issues in Singapore, and this can actually result in the fall, as well. So in order to prevent this, the only way forward is to have regular eye checkup. So from a regular eye checkup every year, you can be able to know how is your eye condition, is there any issues with the eye, and treatment can be rendered early, and you can save your eyesight as well, and it also can help to prevent fall. And also, most importantly, adopt the healthy lifestyle, which I shared with everyone. Yeah, next slide, please. Okay, so these are our reference, and yep, thank you so much for everyone's time. Yeah, so we invite any questions, please?
Yes, may I ask you, just now I see your photo, there's one, my question is, can I get equipment to measure my cholesterol level, like in Guidance or Unity? Thank you.
Oh, okay, if you would like to measure your cholesterol, level of cholesterol, you can do so either in the polyclinic or either in your private GP. So they will need to do a fasting blood test in order to check what is your cholesterol level, and this will require the doctors to actually take blood for analysis. So I do not think that pharmacies do have that service. Yeah, hope that answers.
I have a question regarding this diabetic thing. I checked the doctor, my diabetic is 7.2 but when I bought a glucometer at home, I test myself in the morning. Night time I fast already. Morning I check my glucometer, my SGT is high, something like 7, 8.
Okay.
Is that correct way? Is that wrong? Is it too high? But according to the record, morning fasting range is 7 to 10.
It's okay. The range is all right. Or okay.
But is it high? After fasting is 7.9. Like today 7.9.
Okay, because okay, the blood sugar that you have been taking, right, ma'am? Sorry to address your answer. Yeah. So for the blood sugar that you have measured is a random blood sugar that you are taking. So this random blood sugar, because our body goes through changes, hormonal changes during the period of night. So let's say if you are having stress or a little bit of maybe certain signs of infection, the blood sugar level may be affected. So the best way to measure a correct the blood glucose level is to have either the 3-monthly HbA1c or the fasting blood sugar. So you were mentioning that you are doing the random blood sugar and you shared that it was 7. So for diabetic cases, we will normally keep them between 8 to 10, the range. Yeah, we can allow a little bit slightly higher threshold for diabetic cases. Hope that answers.
Yeah, but also when after that I fasting before lunch I take my blood sugar level a bit on the hungry side will be 5 or 6.
So it's okay. So it's still all right. It's still within the normal range. But however, do bear in mind, ma'am, because if you were to fast, because what I'm worried about is that if for diabetic cases, if let's say if you were to fast over a prolonged long period of time, you can go into your blood sugar can go very low, and because you're mentioning 5, so it's still okay. It's still within the normal range. Yeah, but need to bear in mind about knowing about some of the signs and symptoms of low blood sugar, like cold sweat, or some like you feel slightly dizzy or something.
Yeah, but my concern is when I do fasting test and is the doctor said 7.2, but at home mostly is 7.9. She said on the high side, but I also eat normal sometimes maybe a little bit sugar, then affecting the blood sugar level, is it?
Yeah, it's still still okay. Yeah, because I think that you have been following up regularly with your doctors. So I guess the doctors will be able to advise you according to your range of like they will give you a target, a certain range. So it should be on range in a way.
I see. Thanks.
Yep, thank
Thanks.
you. Thanks for your question.
Yeah, but another question.
Hello, ma'am. I'd like to
Yeah.
add on to what Vincent explained to you. So what you take in the hospital, in the clinic or the polyclinic, the 7.2, right, is the 3 monthly blood test. Is the different from what you are taking from the home. Yeah, so the doctor tell you that the 7.2 that you're taking in the hospital is different from what you're taking from the home. Because when you're in the hospital, you're taking from your blood vessel. But at your home, you're taking from your fingertips. So there will be some difference. Okay, so that's the reason why the doctor asks you to take your sugar level at home, right? That is why you have the blood pressure kit at home.
No, this I buy it for my own interest, because what I do the blood test in the hospital is 7.2. Then when I do the fasting one at home, sometimes 7, sometimes 8. It make me worry.
Okay, so are you diabetic? The first question, are you diabetic?
No, they say that because I was a pregnancy gestation, then they noticed that I diabetic. So they say on monitoring the food, monitoring food, not on any medication.
Okay, so actually your blood pressure, your sugar level is within range lah. Okay, so so long it doesn't fall below 4 and doesn't go above 10, that is between range. It depending on what you are eating also. So if you are so worried, you write down your sugar level every time. The date.
Yeah, I write down. I got record
very
on
good.
that.
Very good. So you
the,
show to the doctor when you have the appointment. Okay?
Yeah, because I see them, they told me they don't need on tablet or on any medication. You just carry on the
very good.
monthly, 3 monthly and 6 monthly blood test with fasting one, the blood I take in the polyclinic. But at home I was so worried because sometimes 7 can be 6, can be 8.
Because it depends on what you eat. Okay, so yeah, so long is like I say above 4, no below 4, and it's below 10. So 4 to 10, between this number 4 to 10.
4 to 10.
Okay. Yeah, okay. Okay.
I see. Thank you. Bye. So what time? The night time is what food should I eat when I'm hungry?
Sorry, yeah, please, ma'am.
Yeah, if I'm hungry in the night, what should I do with my this kind of situation? They asked me to eat green apple. I try green apple.
You're hungry at night. You said you're hungry at night. So
yeah,
what do you so what do you usually eat?
I usually eat fruit. Sometimes apple, sometimes I eat the bread with cheese inside and a plain water, or maybe a cup of green tea, like that.
Okay, I will suggest a warm milk, okay, or something like warm milk or Milo lah. But
Milo got sugar, they tell me don't eat any take sugar.
Then you drink milk lor, and lean milk, good for your bone also. Some milk lah, or
the non-fat milk lah.
Okay.
Okay, thank you.
I also don't want to ask you to eat so heavy at night lah, so maybe a warm milk is
but
good.
Because you take warm milk, then you keep getting up past urine, you see. So I want to something that not frequent past urine, so that I can have a good sleep. But usually you have to wake up 2-3 times. Daytime are very groggy the head.
Maybe, ma'am, I can suggest you can have like maybe 2 or 3 plain crackers. You know the plain crackers that you have at home. Yeah, maybe you can have a little bit of plain crackers at home. It may help you, but without the sugar lah, definitely lah. If with the sugar one, definitely your blood sugar will be very high.
No, sometimes I put some peanut butter. The one that no sugar one, the peanut butter you buy in the shop.
Yes. That one works.
Okay, looks okay lah, huh?
Yep. Good.
Hello.
Thank you.
Hello, may I ask another question?
Sure.
Yes. If the eyes like become yellowish, is it a signal for something wrong? Getting something wrong?
Yeah. So if your eyes, the white side is a bit yellowish, then probably you need to see the doctor lah. Maybe some indication that your liver may have some problem.
Oh.
Yeah.
Okay, thank
Mm.
you.
Thank you.
Mm.
We have
Hello.
another few questions to yes, hello.
Yeah, because I'm also a diabetic. So normally I have a 3-month test in a clinic, polyclinic or hospital. So fasting is normally is 10 hours, correct? Before you do the test. So
No,
what is the actual
6 to 8 hours.
okay? So what is the actual range? Sometimes are very confusing. The actual range for fasting test in a hospital,
Fasting test for the blood, is it?
Yeah, sugar fasting test.
Okay, ma'am, you say you are diabetic, right?
Mm-hmm.
So if you're diabetic, usually you will do HbA1c, right? The 3-month one time, not the fasting one.
No, I also do other tests also. They also monitor my lipid profile.
Okay, but because now you're talking about diabetic, so fasting blood test, usually if you're diabetic, they don't really do fasting blood test unless they want to diagnose you to have diabetic, then they will do fasting blood test. But you're already diabetic, taking diabetic medicine, they will do HbA1c.
Yeah, they also include, because every 3 months they will include other tests inside.
Yeah, so
So
your fasting blood test is diabetic related or lipid related? You need to be specific.
there are other tests, cholesterol test also.
The normal range, I don't have it offhand like that. Like, do you have the report when the doctor give you?
I have.
Yeah, so usually they will give you the number ranging with the bracket, right? They will tell you that one is the normal range. Yeah, actually, okay, so the doctor will give you the report every time after taking blood test. You will see the doctor, right?
Yeah.
The doctor.
I have the report with me,
But here got so many people. Sorry, I don't. Do you want to talk to me offline later? Then I can explain to you about the cholesterol. If not everybody will know your cholesterol level. Yeah.
Oh, it's okay, because why is that we share out together.
Oh, you want to share? Okay.
Yeah, because everybody needs to know, Okay.
Okay.
I have a lipid monitoring. That is cholesterol, HDLC, LDL, HC, and also cholesterol ratio and renal panel profile. Also, EGFR. I don't know what is all that. Then they also do for me.
Hello, sorry to disturb. Is this Madam King or Madam Yong? Madam
Yeah.
King, right? Yeah. So I think it will be better for our nurses to contact you. And
it's okay. Okay, understand.
because
I know
it's
you
a
got
bit
question to ask. Yeah.
As in, because it might be slightly difficult for our nurses to actually take a look without the report itself. It's very hard for them to visualize what you are trying to explain as well. So I think they might be giving you the wrong advice based on the interpretation that they are actually receiving only. So without the visual, it might be slightly tough for them. It's not because they do not want to, but we are afraid that we are giving the wrong advice based on what we are just hearing as well.
Oh, okay, I understand.
Yeah.
Maybe how to contact you after offline?
Perhaps meantime you can share our hotline number first, then you can drop us a call and we will take down your personal information and we will pass it to our nurses, either Michelle or Vincent. Then he or she will contact you after the health talk. Would that be better?
Yeah, you give me the number.
Okay.
Then I will because now I
can-
don't want, because there's a lot of question coming up also. So I don't want to interrupt with others.
No problem.
Understand.
You can call the 97718842. Try to contact using the handphone number given rather than the office line. So you can call 97718842.
I repeat, 977188.
8842.
977-8842.
Yeah, 97718842.
Yeah, I got it. Okay, let's continue.
Can, no problem. Yeah, so you can drop us a call and then we will help you to arrange a call with one of our nurses. And if you stay within our nurse post area within these 5 zones, then perhaps we can actually see how we can help you accordingly as well lah.
Oh, okay, okay. What if I ask the community nurse? Because I'm staying in Bukit Merah, so there's a community nurse around here.
Then no problem. Perhaps you drop me a call later on, then I will discuss with you and I will do a referral to our Bukit Merah community nurse as well.
Okay, thanks.
Nana.
Okay,
No
okay,
problem.
thanks.
Okay.
Thank you.
In view of time, we have 5 minutes more actually. So any more questions? I think I can take in one more questions regarding the fall prevention, regarding your shoe wear or even on your eye care.
Sorry. Because I started my Zoom call 15 minutes late. So can I review the first few slides?
Oh, for that, right? Do you have a Facebook account? If you don't have a Facebook account, we're actually doing a recording session for under the Silver Click Radima's Facebook page as well. So you can actually view the recording sessions over there also.
Oh, okay.
We will probably share the Zoom, the Facebook link again. Gary, do you mind sharing the Facebook link on the chat as well so that they can actually take a look? So wait for a while, we will share the Facebook link on the chat as well. Do look out for it. Will that be okay?
It's okay. Thank you.
Another question. You have this 5 center that for the community nursing care. Beside that, other people that stay away from those areas, what they shall do to have the contact?
Okay, for that, I think I will take over the questions, Michelle and Lisa, for that. So, for SGH itself, we actually take care of these 5 zones as shared on the screen. So, if you are saying, I understand that we have a lot of listeners, actually it's from Woodlands, Ang Mo Kio, and Bishan area, and even Bedok, I heard. So, it's really depending on which area you are at, and we have the different various community nurses at different institution itself, but the service they provide are slightly different. So you can, if you're actually quite tech savvy, you can actually Google which hospital is near you, and they have this community nursing program, and they have a different hotline you can call up to actually check with them what type of service that these community nurses do provide, because different hospital itself, they provide different programs also.
Oh, I see. Thank you.
Welcome. Okay. Any last questions that we can take in, or anyone would like to share about your experience as well?
Yeah, regarding the shoes problem, the thing is that there is a specific place that you can buy proper shoes to wear, like a stretcher. You know, they sell good shoes for the walking one. And what are the shops that can purchase better shoes, control on the leg?
Recommendation is to wear sports shoes lah, covered shoe lah.
Yeah, I know we have sports shoes. Some of the sole is flat, but it's a soft grip good. But I find I wear that one tends to on the not so risk prevention. It's better you buy the hard firm one. You buy a stretcher. It's a good, expensive, but it's worth buying it.
Yeah, I agree lah. There's actually various area you can buy lah. Actually, you go to those market, they also have those store that can sell. They also sell quite firm, covered shoes. Okay, but to me is shoes importantly must try and walk with it to see whether okay or not. Yeah, must comfortably must try one, then you know whether comfortable, whether suits you or not. Because one shoe don't fit all ma. Right? So we have to go and try the shoes lah. Like what you share, Skechers is really quite a good brand to wear lah. But some elderly may not be able to afford, then they can go to the market, you know, there where they sell like good also and good grip sport shoe that got all the velcros also lah.
You
But
see, there is the sport shoes, the sport shoes and walking shoes. Is there two difference or not?
actually sport shoe got different. Every sports wear different shoes.
You
So
know, they
for-
say sports shoe, it must be firm. Walking shoe must be, the sole must be soft. So for elderly, advised to wear hard sole shoes.
correct.
Because I tried two type of shoes. The one that I have a soft shoe is meant for walking only. Then the hard shoe is meant for long walking distance, and that you can grip the leg better. So there's two different type of sport shoe you should look out for elderly.
Okay. Thank you for sharing.
Because I'm very concerned of all the health problem, because
Yeah.
the last time I had the fall, because I noticed that not one time, two time, because the soft sole it doesn't grip properly on the floor, on the
Yes.
ground, no? And then
Yes.
I decided to go to stretcher there and bought the firm type one, and with the broad front, and it helps me walking now without risk falling.
Yeah. That's why sport shoe also got different brands. Different brands suits different people huh?
No,
the
I'm
important
just talking about the sole.
Yeah. Important you must find the right brand. Some different brand got different type of sole lah. So you must find your own liking, your own comfortable style lah. Yeah.
Yeah, that's correct. Thank you.
Thank you.
Hello, can I have the last slide, please, on all the website link?
Can, no problem.
Thank you.
This one is it? Or
The last one. No, not this one.
the
All
reference
the
is
link,
it?
the eye center, the link.
Okay, give me a while lah.
Uh-huh.
Got 2 slides left. You finish taking picture, then you let me know.
This one, the community nurse, yes, I have. Okay, just a while.
Got 2 darling. Got 2.
Wait, I haven't finished.
Can. This is 26, page 26. Still got 27. You done already? You let me know.
Okay.
Okay, this is the other one.
Okay. Wait. Okay, thanks. Thanks
No
a lot.
problem, May. You're welcome.
I think Radhima also have posted shared their Facebook link on the chat box itself though. So do click in before you end this health talk as well, so you can actually save their Facebook page as well, so that you can actually follow through us on our recorded sessions. Even if you miss like last week's session, you can actually review it at their Facebook page as well. Okay, so in view of time, it's already 3 o'clock. So once again, thank you Michelle and Vincent for the sharing and everyone's participation as well. So for Madam Keen, you can actually drop us a call, then we will actually discuss further from there. Okay, so meanwhile, once again, Happy New Year and Happy Valentine's Day to all of you. Have a good time spent with your loved ones and your family members.
Thank you for the talk.
Okay.
Bye-bye.
Bye.
Take care.
Bye.